It should be called Celebrational Evening tonight because I've just completed my IV course. So I'm really happy about that I've got through it, and it's been a quite, I wouldn't say easy cycle, because none of the cycles are easy. They do get a bit, mental, as in you're battling with your mental side, should I say, a bit difficult, just because of the way things happen, morning, evening dose, the fact that they take an hour most times and then an hour at the night time, and just, you don't have to entertain the nurses, you don't have to speak to them, you don't have to do anything, but just because when we're feeling crap, we sort of put a mask on until they've gone. We'll talk to them and things like that. But yeah, most of the time we're drained and we just agree. We just agree with him most of the time. So yeah, completed that. Um, what was weird this time around, the nurse asked me, "Do I want to keep my needle in?" So I said, "They've never kept the needle in before." I said, "And I don't feel that bad now. I feel like I've picked up from it. So if anything goes wrong with the bloods, they'll probably just tell me to follow it up at the GPs, or the specialist will follow it. I can't say that. Follow it up." So yeah, so it's kind of a celebrational day for me, even though I'm not doing nothing. I'm not celebrating with a beer. I did want to do something though at the end of my cycles where I do sort of, celebrate, because it is difficult. And we do get a few days where we don't feel too bad, maybe a week here and there. So, instead of going into my IVs feeling disappointed, knowing that they're coming up, I give myself something to aim at the end. And I think that, every time it's coming around, if I know I'm going to have a little bit of a celebration or a drink, or whatever it is I choose to do after that, whether it's, go out to do some retail therapy, whatever the bloody thing is that I do, at least at the end of it, I've got a bit of a program. So I don't look forward to the IVs, but I have something to look forward after it. So that's what I'm putting in, and that's what I'm putting in place, because they do come round sooner than you think. You blink and you miss it in the background. 3 months sounds like a very long time, but most of the time it's not. It's round, and the way my IVs have been landing, it's every 4 months. So if it feels like it's 2 minutes and it's every 4 months, then I'm from Manchester, Carmick. Where are you from, mate? I've just finished my 2 week cycle of antibiotics, which is home clinical IV therapy, so I don't have to go to hospital. So yeah, I picked up quite a bit round about day 6, and every day after it I felt a little bit better, a little bit better. I've got the colour back to my face. I took a picture not so long ago whilst I was on treatment. I was wearing this hoodie jumper, in fact, and I just looked drawn, I looked pale, and it's just amazing to see the contrast of when I started and then when I finished my cycle of IVs. So, like I say, people that have been drilled to tell us, oh, you can get resistant from an antibiotic. It's basically belittling us. Well, that we must be having a phantom infection then, or we don't need them. So yeah, it's a bit of a piss take, but this time my blood's shown a bacterial infection, because before we commence treatment, we have a blood test and then we have a sputum test. So the sputum test is to try and find what bugs isolated in your sputum so they can get the correct antibiotic to treat it. But if they can't find nothing on that, then they have to go off other things like blood tests and your heart rate, your temperature, your blood pressure, all these things. So these idiots who think they've got something in place to try and mess our treatment up, it's not happening. We're poorly people and we need it. So that's why I made this channel not a while ago, because I was sick and tired of the discrimination, the neglect, especially with bronchiectasis. Yeah. Oh, cheers, Christine. I don't live in Leeds, but if you want to give me a free call out, I'll give you some advertisement on here. Only joking, but yeah. So this is where the kind of thing it is. Like, I went for the British Lung Foundation. I wrote a letter to someone called James Chalmers, who's the main guy from Edinburgh that deals with chest conditions, and I was getting so pissed off that we was just falling under the umbrella lower and lower and lower when we're exactly the same as cystic fibrosis patients, nearly spot on the same, just a different gene. They tested for the gene and they can find it. Maybe we have a maybe we have a cystic fibrosis gene that they can't detect yet in bronchiectasis. I don't know. Now the people who only grow one, the only people who grow one bug, yeah, they they should have to go through a lot of stuff to get on antibiotics. You know, long term, um, either be resistant to it and grow it frequently. But people like me, who who show multiple of different infections, not just the same bug that they can just throw a treatment at. But I'm clinically diagnosed as bronchial sepsis, which basically means my lungs are fucked. Always get infection, so you can't play Russian roulette with me. And this is the thing. I can understand them doing it to say for instance, a patient who comes into the hospital and then they get the lung doctors to come and see him, and it gives him a brief description of his symptoms. They've cultured something in the sputum test, but what the main thing that they're doing in the hospitals, instead of treating the patient in hospital, they say, "Oh, we can get you back in the community now. Um, they'll take over your care." So this person who's not gone through what I've had to go through, yeah, to get this medication, such as medication stopped working for me. I was getting resistant. Certain nebulized antibiotics were giving me side effects. I couldn't tolerate it. And then I got my IVs, right? That's how I got my IVs. I had to go through everything. Now, what they're doing, they're taking patients out of hospital who probably only had the first, second admission with a bug, telling them that there's a whole home IV care, and then they're getting to stay on it. And that's not right. You know, there should be a process that I had to do, that I had to fight for, that I had to trial all this medication and it not work, and and I wasn't getting any better. But it seems like I don't know. I think they're putting too much pressure. They're putting too much pressure on the system. They don't know whether to keep him in a hospital and treat him because they need more beds. Right? They clearly need more beds. They don't know whether to keep him in hospital because it's a risk of catching another infection. So they put him back into the community. But your district nurses, like your district nurses who come round, yeah, they can administrate IVs, but it's more likely that they're going to pass it over to, in our instance, the Northern Care Alliance, who are a rapid response team. And then you're just going to get flooded and flooded, and then they're not going to be able to cope. So by them not being able to cope, they're going to scratch their heads and say, how can we get rid of some patients? And the people like me, who's on lifelong treatment, who's got a port in his chest, who's got scientific backed up microbiology lab testing and blood results, is now at risk of losing his medication because they're getting every Tom, Dick, and Harry on it who's not had to go through what I've had to go through. I had to change specialist because my specialist weren't taking me serious. I had to go for a bronchoscopy and everything, where they found a bug that I couldn't get up in a sputum pot, and then I had to go back into hospital to be treated. They found my lungs were slightly reacting to mold in the air, yeah, and things like that. So, I even said to my specialist, "You show me on." Obviously, they're not allowed. They're not allowed. But in the heat of battle, I said, show me someone in this place who grows as many bugs as I do and different varieties who's not on IVs. Yeah, who's not on IVs. Oh, we want to keep him till you get older. Oh, we want to keep him. We want to keep him till you've got a really bad infection. I'm not going to get a shark bite. One, I can't fucking swim. I can't swim, and one, I'm not likely to get bitten by a shark. So when I think about infections, the only infections I'm really going to get is in my chest. I'm very unlikely I'm going to, get a leg infection, a skin infection, or something daft like that. So no, it's not about, for me. It's not about holding my holding the artillery back until I'm old and someone's pushing me in a wheelchair. No, no. What quality of life is that? And Irish eyes, you okay, mate? So no, you got to stand. You got to stand firm. You've got to know. End of the day, you've got to know that you're not a well person, kind of thing. You've got to stand your ground, and don't budge on it because you know it's not our fault. It's not our fault that there's these new demands, getting patients out of beds and putting them into the community for treatment. Like I said, don't want to bore you, but the next protocol should be getting them a specialist if they've not got a specialist, then trialing them on basic antibiotics. Your basic antibiotics, amoxicillin, doxycycline. Most people get them for average infections, yeah? If you grow a bug called Pseudomonas in the chest, it's very bad. So there's only one tablet I think you can take. It's called not azithromycin. Shit. What is it for Pseudomonas? Shit. I've not took it in a long time. I forgot the name. There's one tablet. It might come back to me. I think it's something like ciprofloxacin, I think it's called. I might be wrong. And that treats Pseudomonas, right? Now, if you're resistant to Cipro, there's no other oral tablet you can take. So that's when you need the IV medication, such as meropenem, tazocin, and there's other catezicin. Can't say it. Castezicin. I'm not going to say it. I'm just not taking my teeth out. So that's when you need them kind of things. So with me, I'm a different, kind of infection. So guy who gets different infections. So there was a time in my life that I was going into the hospitals and I was having arguments with the doctors saying, listen, this has been going on for about 8 months. I've been going on this tablet to be told, don't go on that one. Switch to this tablet. Take that didn't switch back to that tablet. I said, listen, it's not working. You might as well give me you might as well give me a toffee. Give me a toffee, and I'll take that for my chest infection because these are not working. Yeah, the battle is unreal. It's a battle that you can only win if you keep pursuing it. If you get the right specialist who's gonna, take you seriously, and not look at you like, you're a young person. There's nothing wrong with you. Yeah, you can't judge that. You can't. Obviously, you can judge a book by its cover. A crackhead looks like a crackhead. Yeah, but certain things are not visible. Yeah, certain things aren't. We talked about this the other day. So you can see someone with a walking stick or a problem with, say, a limp, and you can say this person's probably struggling. Other things like with chest conditions, you'll see them coughing. Obviously, coughing's one. Chest pain, wheezing, but obviously, unless you write down the eardrum, listening to the wheeze in the chest, you might not pick the wheeze up. So anyway, I'm not going to speak anymore because I think I'm going to shoot off. I just want to say thanks to everyone who's been following me through this little journey I've been on. And I've been a little bit, not day by day. There've been some days that I haven't been on. But, I did say next time I'm on, I do what a kind of, what's the word for it? Do like some kind of program. I can't get my words. My brain's thinking, I can't get the words. Like a program to show you how it's been. So what I've got to do tomorrow morning is there's no messing about. So what I usually do after this IV antibiotic medication, I try and have a week or two off anything, just because I want to feel normal. And with medicating every day, and then you've just done a massive 2 weeks on strong antibiotics. So the last thing you want to do is be pumping yourself with daily antibiotics the day after. So I've just had the needle out the day after, but I'm gonna do it. Um, I've got no excuses. I don't want to be in hospital over Christmas. I want to try and keep myself as well as I can possibly. So as I'm getting older, I'm trying to reduce an infection here and there. So just keeping my mind strong more than anything, because like I say, everything's not physical. A lot of it is mental, and this is what beats us in the end. So we've got to stay strong, guys. And if you've not hit the like button, what are you waiting for? I've had over 17 people watching me, and not one person's given me a like. Not one person has given me a like, guys. I better gained a subscriber. Yeah, or I might have lost one or two. So anyway, Irish Eyes, you're not speaking much today, so I don't know if you've gone. My pal Nocturne, he's not on. So yeah, I'm gonna shoot, guys. I'll upload this one, and I'll catch you on the next one. Don't know when that'll be. I might have a break now. Obviously, it's been a stressful time, and try to keep you guys updated as well while feeling like shit. It's not been easy. Right, see you later, guys. Take care.